Public transportation, it's an essential part of being able to participate in activities such as healthcare, education, employment, shopping, social events. Northeast Indiana is home to about 12 of the 68 urban and rural public transit systems in the state. And without available, accessible, and affordable transport options, people have limited ability to participate in activities and enjoy limited independence. Fort Wayne's CityLink shares its story.
Every day, thousands of citizens from all walks of life rely on CityLink to get to school, work, healthcare, shopping, and more. For them, public transportation is a vital connection to life, community, and opportunity. Yet, public transit is inadequate to meet even basic needs of some 8,500 households who do not have access to a car. People with disabilities, senior citizens, youth, and those who seek alternatives to car ownership deserve safe, convenient, and dependable transportation. Community leaders recognize the needs and have envisioned expanded public transportation for Fort Wayne, but the challenges are great. Public transit has been historically underfunded in Indiana compared to neighboring states. Indianapolis, however, has been given special abilities to expand public transit, increasing local funding and bringing hundreds of millions of dollars in federal investment to the city. Indianapolis improved transit only when the community came together with one voice to demand it. Imagine more buses, serving more destinations, with expanded late-night, weekend, and on-demand services. Together, we can build the public transportation system our community expects and deserves.
In 2023, the Community Transportation Network initiated an in-depth transportation needs assessment in our region, partnering with organizations like Fort Wayne CityLink. And we'll discuss the report's results and recommendations on this week's Primetime. Good evening, I'm Bruce Haynes, and with us today is Justin Klepper, Executive Director of Community Transportation Network. And joining Justin is John Metzinger, CEO and General Manager with Fort Wayne CityLink. And we invite you to join our conversation as well. You can call in if you have a question or comment. Just use the number that you see on the screen. As we once again widen out and welcome Justin and John to the program. Thank you, gentlemen.
Thank you, Bruce.
Thank you.
I wonder how many people think your two organizations are the same organization. Does that happen a couple of times a week?
Daily, probably.
Daily?
Daily.
Okay. It's another way of saying, tell us how you both complement each other when it comes to public transportation. Justin?
Well, CTN was created in 2000, actually 24 years this month, to really fill a need that was present in our community. And part of that need was a gap that we were seeing through public transportation. And so we really worked within a niche to support the greater work that CityLink is doing every day in moving massive amounts of people. We're focusing in on folks that need a little bit extra assistance, what we provide and what we call hand-in-hand, door-through-door assistance, getting to healthcare appointments, getting to employment, and then working with the community for greater projects.
Wow. You have quite a larger anniversary whenever that time comes. I saw 1870s as something about the time when public transportation and Fort Wayne were a thing.
It's true, Bruce. Public transportation has existed in Greater Fort Wayne since the late 1800s. CityLink was formed in 1968. Prior to that, it was privately operated, but it became a public entity that year, and we've operated ever since.
And as a result of that, and with the city's growth and the region's growth, we all love growth. But then this is the infrastructure part of a kind, I assume, because it can be roads, it can be bridges and sewers and telephone lines. But public transportation, I'm wondering what were things you all were seeing over the last 5, 6, 7 some years where you're starting to recognize it's time for an assessment.
Well, and CTN was created in 2000 because of an assessment in Allen County that the Follinger Foundation funded.
Okay.
So they did an assessment like this back in the late 90s took the results, gave them to the community, a group of nonprofit leaders as well as CityLink, and said, okay, solve this, figure this out. And out of that, it wasn't an expansion of one agency's services, it was a completely new agency. What CityLink or what CTN has done now, our board has said, what does the rest of the region look like? And so that's how we got to this regional assessment and working with our partners like CityLink and the other rural transit providers throughout the 11 county region.
Is this a matter of how do you keep up when someone says, hey, we've now have a few more neighborhoods and we're taking the city limit out to X and things of that nature?
Certainly, when you look at how infrastructure in Indiana's second largest city has grown, loss of sprawl, which is challenging to serve from a public transit perspective. Infrastructure, considering that public transit riders are also pedestrians, it's important that sidewalks, crosswalks, and connectivity exists for people who are walking to catch the bus. And that's a very great challenge on the outskirts of our city.
And as you say, Justin, this was not just a county-wide. This is a fairly large-scale, all 11 counties in kind of assessment, right?
It was. So, even the consultant that we'd brought in really hadn't done something of this scale, of this magnitude, to really look at an 11 county area and to understand where are the transportation gaps, what is being provided right now, and where's the need still relevant, and how do we start to fill those needs. Bringing all of those different parties together was a challenge, but everybody recognized the need for having greater communication and, more importantly, collaboration, and so we all came to the table to get this done.
Mm-hmm. And as along the way throughout 2023 in these other 11 counties, fairly safe to say some aspect of a CTN or a CityLink is present in some counties, but maybe not to the same degree as Allen County.
Yeah, public transportation exists in most counties surrounding Allen County, with one exception. So across the state, it's important for elected leaders especially to understand that public transit is as much a rural concern as it is an urban concern. And what we're seeing and what comes up in the study are the needs that are there, considering that a lot of senior citizens live in rural areas and need transportation into Allen County to access health care and other needs.
And so let's take a look at what the tail of the data begins to show, because as you mentioned, this is a broad survey as a transportation assessment, and some graphics that will help share what some of the data says. Were you impressed with the way the process played out?
So one of the things that we wanted to understand was making sure that as we were collecting data, that it was statistically relevant. And the consultants came back and said, you need at least 4,100 survey responses to be statistically relevant. We had that with over 2,200 surveys. Out of that, we had respondents that were 16% were over the age of 65, 24% have a disability or they live with someone who has a disability. Some of the other unique questions that we were asking about is related to pregnancy and prenatal health. 21% of our respondents said that they had had a baby or they were pregnant in the last 18 months. And then obviously one of the things that we want to understand is related to who can't drive legally. And 21% came back and said that they had a legal violation that kept them from driving. When you have that violation, you need public transportation to get where you're going.
Mm-hmm. When the data came back too, it looked like it was relatively representative across all age groups. This was not necessarily heavily 55 plus or 18 to 25, but everyone was in.
The need was across the board. And a lot of times I think, especially when we look at what CTN does, where we're serving low-income seniors and people with disabilities, folks are primarily looking at that population. But when we go out into the communities, when we go out into the rural areas, it's anyone of any age that needs transportation. And we have young people today that are actively choosing not to get a vehicle, even get a license because it's so expensive.
And I assume the persons and the situations that that individuals find themselves in work for CityLink as well as for CTN in this case?
Oh, absolutely. CityLink, one difference between the two organizations is that CityLink provides public transportation available for everyone. So considering the high cost of car ownership, or for those folks who don't have access to a car or are unable to drive, may choose to ride public transportation. The service meets a lot of needs today, but if it could be expanded and grow, there are a lot of unmet needs.
In fact, let's look at that, because they're under the obstacles to driving yourself. Some of the data that came back would speak to aspects of all of our lives to some extent, but not the least of which is the cost of keeping the old clunker clunking.
Exactly. I mean, you've got folks, I mean, we've experienced it even with our vehicles. Inflation has hit everything from fuel economies to the cost of repairs. That's always a constant challenge for what we're looking at, and it's a constant challenge for the average driver as well. So other obstacles, we know that driving at night is a challenge, and so we want to understand that. We want to recognize that these are real obstacles for people.
And so when you're not able to drive yourself and you are looking at using transportation services, there are obstacles there. Let's share the results of some of the top line on that one.
So I don't think the top two really surprised John or I, or really any of our provider partners, saying that no service is available. And a big part of that is just because we don't have the capacity. We don't have the ability to bring in enough vehicles, drivers, to fill every single need out there. And so folks consider that to be no service being available.
John?
Yeah, and related to that, the funding challenges for both in the private side for CTN and the public sector for public transportation, CityLink. Indiana has underfunded public transit, as was shown in the video. Mm-hmm. That's a very great challenge, given that the needs are so great. So there's a lot of room for the community and for people who want public transportation to have conversations about the funding mechanisms that are available to provide it.
Isn't there a reference in the study to public transportation being able to take someone to a doctor appointment or to work, but then the non 8 to 5 side where you're shopping for food or you're wanting to connect, that this is a whole additional list of considerations?
So when we look at the impacts of no transportation access, the biggest concern came back to limiting the ability to shop for everyday things, limiting the ability to access the bank, the pharmacy, things like that. I mean, 27%, 25% came back and said, those are what I need to be able to get to. And we're restricted on, not restricted, but capped on how we can serve because of the greater need of getting folks to the doctor's office. And CityLink has a challenge of their capacity to serve later in the evening. It's a real challenge for all of us.
Yeah, that absence of late night service is one of the indicators for that 18% of respondents who said they are unable to access jobs outside of working from home. And so there are a lot of second and third shift employees and employers who would like to get them to jobs who are currently unable to do so. And this is a great challenge for the community.
And even across the age range in the Allen County segment side, and we'll share momentarily how you can follow along as the survey results are made public online. You can dial this up as well. But the challenge of how late is late enough to run lines and service, and then to differentiate between weekday and weekend.
Well, and I think it's not just how late you go, but where do you go? It's thinking about how far out you go. One of the things that came up through the study is the real challenge of inter-county travel. The need to connect between Allen County and Whitley County or Kosciuszko County and vice versa. We have healthcare systems that are moving into larger regional offices, and that requires folks to move from one county, go from one county to another to access possibly their doctor, or at least to access the hospital. And so having those kind of inter-county travel costs are significantly more expensive.
I don't know that that's necessarily something that comes to mind on its own. John, I mean, you would just necessarily think that it must exist somewhere, but apparently it is not necessarily anywhere at all.
It does exist. There are other states do have models that provide regional transportation. So there is a roadmap that we can follow. One barrier is some outdated state legislation that prevents public transit agencies like CityLink from crossing the county lines. So for example, we launched a van pool program. Think about a carpool, except the vehicle is subsidized in partnership with the employer and CityLink. And it's been a little difficult to get that launched, primarily because of this issue, that the needs for workforce mobility are regional in nature.
Here's one that's sort of related, just within the same region. Wesley is checking in with an offline question. Are there plans to expand service to Parkview Southwest?
So yeah, CityLink is going to be doing a study this year and next, which will look at all the needs in the community, including Parkview on the southwest. That location is currently served by our Access bus, the paratransit bus for people with disabilities. However, there is no fixed route bus service there currently. So that's one of the locations that will be studied. Should funding become available, we would be able to provide that service. And there's also the possibility of partnering with Parkview or other organizations to provide the service.
We're at the place where there are additional findings that can come from the study, and again, we will share where you can find this online as we go forward. The travel between counties apparently a key takeaway. Another that I understand is out there is the idea of public transportation options throughout Northeast Indiana. You each seem like the other's option. What else are we looking at?
Well, CityLink and CTN work very closely together. It's a good symbiotic relationship between the two organizations. One strength that CityLink has is that we're really adept at using federal funds, and so we pass some federal funds to CTN for operations. So that solution works really well, that on-demand transportation that CTN provides and CityLink provides through our paratransit bus, the Access service. But we are looking into other modes, thinking outside of the bus. So for example, on-demand services, very Uber-like, could be an option for Greater Fort Wayne, as long as those services are affordable and accessible to people with disabilities.
Got it. Let's go to the phones briefly and welcome Fred. He has a question for our guests this evening. Fred, welcome to Primetime, sir. Go ahead.
Thank you. The question I have, I'm a former refugee caseworker, and my question relates to what kind of input that the immigrant community is being sought, especially related to limited English access.
Well, I will jump in on that one. So Title VI of the Civil Rights Act actually requires public transportation agencies to provide translated material to non-English or limited English populations. So here in Fort Wayne, Spanish and Burmese are two large populations, so our material is translated there. Beyond that, our outreach personnel are engaging with community providers who serve the immigrant community, and we're always looking for opportunities to connect in more deeply with the community. Thank you for the question.
We're at a point, too, let me ask you both. It's that next steps question. Now, certainly the ink perhaps is still drying on the report, but Justin and John, a question for each of you. What are your initial takeaways from the report? What do we do with the revelations that have come from this past year's work?
I think, one of the biggest revelations I have is that national data that we've seen related to access to health care was mirrored in this assessment as well. 23% of respondents said that if they don't have transportation, they're not even scheduling a doctor's appointment. And so when we talk about early intervention being critical to everything, it's being mirrored in this study. It tells us that the data that we have here is real, it's correct, and it's something that we need to be looking at. It tells us that as providers throughout Northeast Indiana, we need to be looking at each other and saying, how do we work together? How do we take the next step and really convene real solutions?
I think another takeaway really is for the whole community, especially the community leaders, to make a shift in paradigm, to begin thinking about public transportation and how people move about the community in different ways than we have before historically, to really think beyond the automobile and to recognize that there is a need to invest in infrastructure and operations that can support mobility for those who don't drive.
At the top of the show, we referenced Indianapolis and Indigo, and wondering what, and maybe you are wondering too, what is Fort Wayne's version of that? And maybe it's not that, but it's like that, and a little bit of something from somewhere else.
Well, there certainly could be some similarities. Indianapolis did a really good job legislatively at the State House to receive special permission that currently we don't have here in Fort Wayne, to raise additional local revenue to support expansion of public transit. But they have a playbook that we can follow, and as Indiana's second largest city and fastest growing metro economy, we believe our community deserves a well-functioning public transit system, and we can follow their playbook to pursue it.
Even the idea of within a county connecting rural with urban or rural to rural.
Exactly. It's making that connection between our counties, between our communities. You know, right now CTN is primarily restricted to Allen County service, but we want to look at how can we support our partners and our neighbors in the neighboring counties and get them into Allen County, or is there a way that if their provider is coming into Allen County with someone, can we help them find other rides to pick up while they're here before they take somebody back home?
Yeah. Even prior to this study, John, you had CityLink had a 2030 transit development plan. So I'm assuming 2023 helps inform the plan for 2030.
For sure, that plan was adopted in 2020, just before the pandemic. And as you might imagine, the way that people move and the way that they work has changed dramatically. So we will be pulling that off the shelf and revisiting the plan, really willing to carry it from where it left off, but also to reconsider all of the recommendations that came from that plan. So we'll be completing that work this year and next, and from there, hopefully we'll have a roadmap for what phased implementations might look like for expansion of transit with additional funding.
With the kind of community input you've had in the development of this assessment, talk of the role of community input as you play out the recommendations from the assessment.
You know, we're going to have opportunities over the next many years to implement some of these recommendations, and we're going to be seeking community feedback every single time at every single level, because at the end of the day, we're the operators, but they're the actual users. They have a perspective that is critical to fleshing out what this really looks like.
Agreed 100%. And there's nothing greater than just getting out on the system and riding the bus, talking directly with passengers to hear their stories, because our riders have stories of impact that can really shape our development plans.
Yep.
Let's take a moment now to tell you where in and across the internet you can be finding what we have been discussing. Justin, let's start with you, where ridectn.org is available.
So our website is ridectn.org. We're sharing a bit of a teaser of the report tonight. The full report will be released on May 22nd. We are excited to share the full report with the community. We have both an executive summary, which is a lot easier to digest compared to the 65-page document that is the full report. And then we also will have county-by-county reports available. So each county can actually see exactly what is happening within their community and how this report impacts their local residents.
And of course, as well on the website, if you are looking to explore services available and other ways to access CTN activity.
Yep, we've got all of our information is on our website at ridectn.org. If you need a ride, if you need help getting connected for a ride, we're happy to work with you on that.
And John, how about for CityLink?
CityLink also has a website available. We also have our customer service staff available. But if you hop on our website, you'll learn information about all the services that we provide, including our travel training program, which I did want to mention today. That is a new program started last year that helps new riders figure out how to access our services. So our travel trainer will meet riders at the bus stop and ride with them as many times as it takes for them to feel comfortable using our service.
It's a great program.
And we appreciate you being able to hop on this bus with us over this past 30 minutes together as we look to the great next developments within public transportation across Northeast Indiana. John Metzinger is the CEO, General Manager with Fort Wayne CityLink. Justin Klepper, Executive Director of Community Transportation Network, or CTN. And gentlemen, thank you so much.
Thank you, Bruce.
Thank you, Bruce.
And thank you as well for allowing us to be a part of your evening with all of us and from all of us with PrimeTime. I'm Bruce Haynes. We'll see you next week. Good night.